far as we can. For anyone that is not aware, we will be going back to the floor, presumably at 2 o'clock. However, sometimes that's, as those of you that follow the legislature know, that can be subject to change. So we will eventually hear bells and know that we are supposed to leave. But with that, since we have somewhat limited time, I want to go ahead and get started. Although House Bill 558 is the chairman's bill. So why don't we, is Delegate Wilson here?
In theory, Madam Vice Chair.
So in theory, can you start with House Bill 648 for us?
Sure.
Thank you.
I'm here to present House Bill 648 for your approval. This is basically for Southern Maryland, SMECO, Southern Maryland Electrical Co-op, and Chop Tank Electrical Co-op on the Eastern Shore. The bill is going to allow SMECO and Chop Tank to hold annual in-person meetings virtually or with a combination of persons in attendance. They were able to host their last meeting, but unfortunately, and they did it in a large warehouse, but a lot of folks didn't feel comfortable coming. And it's about making it more convenient for SMECO members to participate in the annual meetings. They plan to continue to allow people to participate in person, but I want to create this as an option. I'm putting this bill in. It is a cross-file bill with Senator Hershey. And again, my colleagues want to remind you that we can take some silver linings out of this pandemic, and one of them can be making it more convenient for our citizens to participate in our legislative process, as well as some of these community meetings. And this would just be a way going forward to do that, to allow these Chop Tank and SMECO to have a mixed meeting, sometimes virtual, sometimes in person, and allow people to meet at their convenience. That's the bill. Look forward to your questions.
Okay, there are just a few witnesses. Maybe we'll go ahead and take all of the witnesses and then we can do all of the questions. Valerie Connolly.
Thank you, Madam Vice Chair, members of the committee. Valerie Conley here on behalf of Chop Tank Electric Cooperative. We support this bill. We held our annual meeting in April, and this past year we delayed it as long as we could under our bylaws and held it in August. But even with that, we held it at the Wicomico Civic and Youth Center in a room that would hold thousands, and we limited attendance to under 200 to try and keep people as safe as we could in order to get to that 50-person quorum requirement in current law. We did broadcast it on Facebook. Our members love that option, and they've asked us to continue to do that in the future. So we would just like the opportunity to have that flexibility in the future, to not have to bring people together and to protect them a little bit better. So we support the bill, and we thank the sponsor for introducing it for us. Thank you.
Thank you. And Tom Dennison.
Good afternoon, Madam Vice Chair, members of the Economic Matters Committee. Tom Dennison with Southern Maryland Electric Cooperative, also here to support House Bill 648. Thank you, Delegate Wilson and the Southern Maryland delegation for the support on the bill. Ms. Connolly walked through the reasons for the bill. It's very straightforward. And from SMECO's perspective, we continue to embrace technology. We want to allow our members to participate in our annual meeting because of the access that they have to our president, our board of directors, and to learn about what's going on at the co-op. And we believe that having a virtual option will allow that opportunity to exist. So we ask for your favorable support, and happy to take any questions.
Great. Those are the total of the witnesses. Are there questions for Delegate Wilson or either of the two witnesses? Oh, I guess I have to do this too. Sorry. I see no questions. So with that, that concludes the testimony and hearing on Bill 648. To be honest, I think even though the chairman's not here, we're going to go back to House Bill 558. And obviously, I'm sure everyone has the fiscal note and the bill, but the bill is designed to make administrative changes to the for-hire driver's license application process, and it generally to facilitate the receipt of driver photographs. And the bill also removes the requirement for Baltimore City taxicab drivers to complete an education course. Sounds like it's a clarifying bill. It removes a general requirement related to the display of specified information on taxicabs and removes taxicabs from the limited list of motor vehicles not required to have seatbelts in the vehicle. Finally, provisions related to 15 or fewer passenger limousines are expanded to encompass all motor vehicles, including a corresponding authorization to be operated by a licensed transportation network operator. I now understand why the chair of the Public Service Commission is here as the only witness on the bill. And it's due to the transportation network operator, which is something we dealt with in a bill last year. So Commissioner Stanek, you are the one witness, so you can help us with this bill.
Thank you, Vice Chair Dumais. As you noted, that this is a housekeeping bill for the PSC. It's our third and final housekeeping bill for the session this year. As you know, we're primarily an energy regulator, but we also have a large transportation safety regulatory role with nearly 250,000 vehicles that we oversee, including taxis, sedans, buses, limousines, and Ubers and Lyfts. You provided a nice high-level summary at the outset of the housekeeping that this bill would achieve in terms of modernization. We no longer require drivers to come to Baltimore to have their photograph taken. We now have an agreement with MVA to take the photos from their driver's license database. We're also doing away with some outdated provisions in this piece of legislation, which requires currently that taxi cab drivers in Baltimore City take a course on how to read a map. Obviously, the folks that are driving Ubers and Lyfts now use GPS, and most taxi cabs do as well. So we would be updating the provision to mirror the times. Additionally, one item that you did not note it, but it is very important, is that for decades, taxi cabs have been excluded from the requirement to have seatbelts in their vehicles. This law would remove that exemption and now require taxis to have seatbelts in the back seat going forward. That is the high-level summary of this bill. I would urge your support. Thank you.
Okay. Any questions for Commissioner Stanek? Seeing none, thank you very much for being here, Commissioner Stanek. And that concludes the testimony on House Bill 558. And we will now go to Delegate Carey with House Bill 969.
Thank you, Madam Chair. And thank you, members of the committee. I'm here today, Delegate Ned Carey, to present to you House Bill 969. This is the same bill that I introduced last year, which was voted favorably in the committee, passed both chambers. However, when it came back to the House from the Senate floor, it was just never processed across the desk due to the early dismissal. But to refresh your memories, in 2019, we passed legislation in many cases was life-saving for individuals with critical medical needs. The Home Energy Assistance for Critical Medical Needs formalized a program that had been a successful pilot. It's now officially operated by the Office of Home Energy Programs, and with somewhere in the neighborhood of about 350 trained navigators. These people take care of individuals who are critically ill and work with them to make sure that they're able to apply for and receive financial assistance to keep their power on. And again, I'd like to thank the committee for the support in 2019 and 2020. And I'm asking again for your support so that we can fill a gap in the service. While all Marylanders that qualify should be able to access this assistance, there are many that reside in areas that are currently not serviced by trained navigators, as well as those in areas where there are navigators, but simply not enough. You'll hear from Cindy Carter, who is with me today, and I'm sure many of you have met Ms. Carter. She's with the Cancer Support Foundation, and she's dedicated a great deal of time and effort to make the connections, create the processes that will help all of those in need to gain access to the financial assistance that they need. So she, along with the Federal Fund of Maryland and the 211 United Way, have designed a pilot program to hopefully fill that gap. This is the exact bill that the committee passed last year. I've made no changes. You have the document in your packet that explains the program. I'll let the experts speak to the program because they deal with this day in and day out. But I do believe that no one should be excluded from the service just because there's no one to help them. And for that reason, I ask for your favorable consideration of House Bill 969. Thank you.
Thank you, Delegate Carey. And Cindy Carter.
Yes, good afternoon, Madam Vice Chair and committee. I'm Cindy Carter, the co-founder of Critical Medical Needs Program and the executive director of Cancer Support Foundation. I'm here in favor of House Bill 969, Power to the People, which is a great addition to the very successful program. Critical Medical Needs Program does require that somebody works with a navigator. Navigators are not plentiful. Navigators are volunteers through medical centers and other foundations that work with those who have medical challenges. Any program to be sustainable long-term needs to have a core of paid people that can act as a navigator. That's what this program would provide. People have to work with a navigator to be in this program, and the best people we feel would, and it's included in this bill, would be to bring in 211. Now, 211 has a fantastic reputation of being able to handle calls. They have a process. They know what they've been doing. They've been doing it for years. And they would be working with the Fuel Fund, which also is another great partner, and they have a process and they know what they're doing. This way, when I have a call from somebody who I just got, like the other day, that has cancer and they're not working with a center that has a navigator, I don't have to tell them we can't help you because there is no navigator. This way, I could get these people involved with a navigator and make sure they're taken care of. So we are in favor of House Bill 969, the Power to the People bill. It passed last year. I'm hoping for a favorable report again this year. Thank you very much.
Thank you, Ms. Carter. Any questions for Ms. Carter or Delegate Carey? Okay, seeing none, we will move on to Debbie Brown. Is Debbie Brown on? I'll come back at the end, but is Patrice Drago there?
Madam Chair, she's my person. She's not speaking.
Oh, okay. Well, that solves that. Robin Lindenberger. Ms. Lindenberger. Okay. Eileen O'Connor-Liebman. Oh, wait. Ms. Lindenberger is trying to get in. Ms. Lindenberger, are you in now? Okay. Karen Mark.
Hi, yes, I'm here.
Okay, let's go to you first, and I'll go back to Ms. Lindenberger.
Thank you. Thank you, members of the House Economic Matter Committee. My name is Karen Mark. I'm the Director of Operations for 201 Maryland, the United Way Helpline. 201 Maryland United Way Helpline strongly supports HB 969, which allows the Power to the People pilot program to reduce barriers for critically medically ill individuals. This bill will expand the reach for those seeking assistance for home energy programs. In the many years that I have worked with 201 Maryland, I have received thousands of calls in which this bill would have been beneficial. Like the grandmother who contacted 211 because she had fallen behind on her rent and her utilities. She's been working from her home as her office building has closed due to COVID. Her son has been incarcerated and his 2 children are now living with her. They arrived without any clothing, and she has been caring for their needs out of her pocket. She is medically disabled and is doing her best to care for her needs as well as the children. Her food and her utilities have gone up, including making unexpected purchases like computers for remote learning for the children. She is no longer able to meet her expenses due to these additional expenses. She contacted programs for help, but had no assistance was found, and some were not open due to COVID-19. Without help, she faces eviction once the courts reopen and a BGE shutoff. If she could get help now, she would be able to meet her expenses in the future. All of our staff at 201 Maryland have a background in social work or counseling. We are also certified by the Alliance of Information and Referral Services, which is the highest certification available for information and referral providers in the human service industry. We are primed to take on the role as default navigators for those who with critical medical needs. And on our behalf of 201 Maryland United Way Helpline, I strongly encourage this committee to issue a favorable report on HB 969. And thank you for your time and consideration.
Thank you, Ms. Mark. Any questions for Ms. Mark? Seeing none, I believe is Debbie Brown in now? Ms. Brown? All right, well, I do see Ms. Lindenberger. So if you would like to go next, that would be great. Ms. Lindenberger? Can you hear me, Ms. Lindenberger? Ms. Lindenberger, are you ready to testify? She's not muted, so I'm not sure what the issue is. Is there Ms. O'Connor-Liebman on the call? I don't know what to tell folks. All right, Delegate Carey, you are muted.
Yes, ma'am. I was just, I can see them, but I can't hear them either. I can see Ms. Lindenberger, but.
Right.
You must not have her volume up.
Yeah.
Maybe that's it. Ms. Lindenberger, do you have your volume up? Or is Ms. Brown available now? All right, Ms. Brown, can you unmute yourself?
How are you?
We're good. All right, go ahead.
Thank you, Chairman Davis and members of the House Economic Matters Committee. My name is Debbie Brown, and I'm honored to be the director of the Fuel Fund of Maryland. I am here today testifying in support of House Bill 969, which establishes the Power to the People pilot program to help provide home energy assistance to critical medically ill individuals. Since 1981, the Fuel Fund has been a lifeline for our vulnerable Maryland neighbors struggling with a home utility hardship during a financial crisis. The consequences of an unpaid utility bill for people with critical health issues can be disastrous. Health may decline further in an unpowered home where refrigerated medications can't be stored safely, or special medical equipment requires electricity to function. The Critical Medical Needs Program partners with the Office of People's Counsel, the Office of Home Energy Programs, BG&E, the Fuel Fund, and the Cancer Support Foundation. The program utilizes 350 trained volunteer navigators housed at medical facilities and community assistance agencies statewide. While Critical Medical Needs Program has generated significant impacts, individuals with critical medical needs must have a navigator to receive support. But if there is no navigator at their medical facility, then the patient becomes lost in the very tumultuous waters of the energy assistance process. When a critical medical needs client is referred to the Fuel Fund from OHEP, they still have a balance due on their BG&E bill. And an important component of the Fuel Fund is the distribution of energy credits from BG&E to the Fuel Fund. House Bill 969 will allow the designated Fuel Fund staffer to pound the pavement for additional funding resources, along with those very critical BG&E credits, to pay the utility bill in full for the individual. House Bill 969 will increase the footprint of the Critical Medical Needs Program, filling an important service gap in our community by utilizing the Fuel Fund's 40 years of established and unprecedented experience in the energy assistance field. As a result of COVID-19, the Fuel Fund has assisted 32 critical medical needs patients with their utility bills. We have granted over $37,000 to date, with an average grant size of $1,200 per household. The need for House Bill 969 has never been greater. On behalf of the Fuel Fund, I respectfully urge a favorable report for House Bill 969. Thank you for this opportunity to testify.
Thank you, Ms. Brown. Any questions for Ms. Brown? Delegate Brooks.
Thank you, Madam Chair. Thanks for your testimony, Ms. Brown. Ms. Brown, how does this differ from the OHEP program, where the state of Maryland provide financial assistance for utility bills and whatnot?
The fuel fund is able, in our bill assistance team, Delegate Brooks, we're really able to go above and beyond and find additional dollars within that community. So if a client is calling us from whether it's the city or the county, we are aware in that toolkit that we have to find them additional funding. That goal that we want is to always get that balance down to zero for that client.
Okay, and also on the federal level, there's this fund called the LIHEAP program, and that helps customers pay for large utility and gas bills. So that's a sort of stay on the federal level that one could seek for help for that as well.
Yes,
Familiar with that one?
Yes, they'll start with the federal dollars down to the state dollars. And believe it or not, there is still dollars that still need to be paid by the client. That's when they come to the fuel fund.
Oh, okay. All right. Thanks, Madam Chair.
Welcome. Any other
welcome.
questions for Ms. Brown? Seeing none, thank you. We will try again. Robin Lindenberger. All right, we'll try one more. Eileen O'Connor Liebman. All right, so unfortunately, I think,
Can you hear me? It's Robin Lindenberger.
yes, we can now hear you.
I'm sorry.
It's okay.
Hi, I work at Maryland Oncology in Columbia. I'm a patient advocate.
Okay, you can continue with your testimony.
Okay, the Critical Medical Needs Program has helped their patients keep their electric on, as well as provide heating fuel at a time when they are most vulnerable. We are a cancer center. Many patients have to make this unfortunate decision whether to buy food or pay for medication, and worrying about utility bills is just such a huge burden on them. And there's a population of patients that are homebound and they're not able to get into the doctors, or they don't have technology to access the virtual visits. So if they were able to come into the office, we as navigators could help them get the proper documents and send them over to critical medical needs. But if this bill is passed, it'll allow the fuel fund and 211 to act as their navigators, where they don't need a physician certification, signed and documented, to get them the quickest help.
Okay. All right, well, thank you very much for your testimony. Any questions for Ms. Lindenberger? All right, seeing none, that concludes the testimony on House Bill 969. We will continue.
Eileen O'Connor Liebman is on my phone. Can she testify?
Sure.
Okay.
Hi, good morning. How are you?
Fine, go ahead.
This is Eileen O'Connor Liebman, patient advocate for Maryland Oncology in Columbia as well. With regard to this bill, it's vital. The Critical Medical Needs Program actually piloted in our office back in 2015, and the majority of all the patients that we've helped during that time have all, been patients that are in critical need. I think with the part of the navigators and being able to use 211 and the fuel fund as navigators is so key, because so many of them don't have the opportunity to have access to a doctor's office or a navigator, and to be able to use them would be such a vital component to be able to allow them to have all the resources and to be able to use this assistance of all these programs.
Okay. All right, well, thank you both for your testimony. Again, any questions for Ms. Liebman? All right, so with that, we will conclude the testimony for House Bill 969. Delegate Carey, we'll move on to your next bill, House Bill 945.
Thank you, Madam Chair and members of the committee. This is my opportunity to present House Bill 945, and it was important that we just heard 969 because this bill is part of the Critical Medical Needs Program, and it's a simple bill that what we're trying to do is we're trying to remove unnecessary obstacles to success for individuals who are qualified for the program. So as we've discussed, having navigators, as you've heard, is key to the program because they're the ones that guide the completion of forms required to get the assistance. Most of the information that's required is on hand to individuals because they either know things like their social security number, they have it in their home. So what we're trying to do, there's one item that requires a third party, and that's called the physician's certification, and it has to have a doctor's signature. Now, in normal times, it's a difficult and cumbersome process. So because what you have to do, you have to visit the doctor's office, and they have to be, it has to be aligned with a medical reason for the visit. It's often not timely. And in some cases, these are people who've been released from medical care and don't actually have access to a doctor. And what we're trying to do with this is we're trying to eliminate the need for them to have to file this physician certificate. And this bill is aimed at those people who are over 60. So in the current pandemic environment, it just further exasperates the issue. These are high-risk individuals that without a vaccination shouldn't be venturing out unless they have an emergency. Plus the current, as you may well know, particularly in my district, the current postal delivery is at best unreliable and in many cases takes weeks instead of days. So it's important to note that we don't believe that this is going to open the floodgates to a vast new population. And that's because the access to navigators hasn't changed. Individuals are paired with navigators by their medical facility or through organizations that help the disabled or ill. And they must meet all the program qualifications, including a demonstrated documentable financial need. What I think this will do is this will stop preventing those who currently qualify from getting assistance they need. We certainly don't want to see another single senior denied access to much needed assistance because they don't have the immediate access to a doctor for their signature. And I have Miss Cindy Carter again with me, who this is near and dear to her heart. She knows the program and she can help explain anything, any questions that we may have, but it's for these reasons that I've just cited above that I ask for your favorable consideration. House Bill 945.
Thank you. And I see the chairman is here now.
Oh,
Hello, everybody.
hello, Mr. Chair.
And Mr. Chairman,
Is Cindy Carter, is that who's up next?
Yes,
Yes.
sir.
Welcome, Miss Carter.
Thank you. Good afternoon, Chairman Davis and committee. Cindy Carter, I'm co-founder of the Critical Medical Needs Program and also Executive Director of Cancer Support Foundation. As Delegate Carey said, people that are working with the navigator makes sure that they're qualified from an income point of view to be in the energy assistance program. So these people are already paired and working with a navigator. We're talking about our senior population. We're talking about people that are 60 and older. Many of them have problems with technology. The mail is not real dependable. And some of these people that would normally go out to their physician are not going to the physician anymore. They're high risk, and it's just become more and more of a challenge to get the physician certification. Now, the physician certification is required component in the program, and this keeps the integrity of the program. Working with a navigator keeps the integrity of the program. However, the physician certification is a challenge for everyone, but it's part of what people do to be able to work with a navigator. However, working with our senior population, the challenges become more and more. A lot of the seniors have very little family support. They're not able to physically get out and get these forms signed. They can't do the technology. And I think from just a humanitarian, common sense, being able to allow seniors to be in this program, work with a navigator, they're already qualified from an income point of view to be in the program. This is facilitating those who are already qualified to be able to work with the navigator to get grants. So these are grants that are already there for them. They're already qualified. We're asking for a favorable on House Bill 9045 to make this process easier for our seniors and not to make it harder for them to keep their lights on. Thank you very much.
Thank you, Delegate Charkoudian.
Thank you, Mr. Chair. Thank you, Delegate Carey, and thank you, Cindy, and all this good work. Generally supportive of the bill. I'm just wondering if you would, if you think that in addition to passing this bill, there's a broader issue about the complexity of accessing the LIHEAP money through OHEP, and if you think it's worth also sort of in addition to this bill continuing to find other ways to improve it for everybody, because I think there's lots of folks who potentially are struggling in addition to those with the critical medical needs, in addition to seniors, that maybe we need to also be thinking about going forward. Is that your sense, Delegate Carey? Do you think there's more to be done beyond this?
Yeah. And I think, I've been working with Ms. Carter now for a number of years on these, and there probably are a broader spectrum of things that we should be looking at. She can probably speak to some specifics, but again, yeah, this is something that I agree with you.
Thanks. And we don't need to go. I don't want to take us too far since we have the time limit today. I think that the work you've done is great. And I think in this critical medical needs area, and I think it sort of highlights some of the bigger structural changes, and the chairman and I were actually speaking about a little bit this morning. So I'm hoping this gives us an opportunity to really look at all of that over the next few years.
And there are, and you're absolutely right. And I would just say this, that first of all, I want to thank all of you for my birthday wish on Sunday, but next year I will be in that category with all those other people that we're doing this for. So yeah, there are bigger issues. There are broader spectrum of things that could be addressed. So yeah, thank you.
You don't look a minute over 25, Delegate Carey.
I feel 85.
But Delegate Wilson looks that age, though. Delegate Brooks.
Thanks, Mr. Chair. Mr. Carter, Ms. Carter, I'm sorry. Yeah, you were saying that the person would have a navigator with this new platform. Would that preclude a person from having the ability to have the navigator go online and get that certification from the doctor, as opposed to having to physically go there to secure that?
Some of the clients that are working with navigators that need to get physician certification now do have a navigator get it from the doctor's office. Okay. However, our navigators, there are over 300 of them now. These are volunteers. There's no paid corps of navigators. So when you're asking the people that are already doing a job for their employers to do an extra task, if that task becomes too cumbersome, then that's a real challenge. So the navigators trying to go to the back and forth with the physician's office to get the form signed is a challenge. If we're make it easier for those who are 60, that is going to at least facilitate the seniors. Part of the problem, the whole reason why critical medical needs program was created is because those who had health problems were pretty much left out, being able with the barriers of trying to even get energy assistance to start with, because it is a very, very challenged system. So by having them work with the navigators, we've gotten there at least the ability for them to do the application. The navigators, yes, do work with the physician sometimes the patients are able to get it themselves, but it does take extra time. The navigators are volunteers. We try to keep and get new navigators in all the time, but allowing this to be done for those 60 and above would help to facilitate the navigators being able to do more successful applications for people.
Okay, thank you. Thanks, Mr. Chair.
All right, anyone else? If not, thank you very much. Debbie Brown.
It's me again. Thank you, Delegate Carey, Chairman Davis, members of the House Economic Matters Committee, Debbie Brown, Fuel Fund of Maryland. Thanks for the opportunity to testify again, this time in support of House Bill 945. Very simply, any reduction in required documentation will benefit clients over the age of 60, since this demographic lacks the most access to technology and would instead streamline the process to provide OHEP assistance. We've seen this age group really get hit hard during COVID-19, and just getting information and fuel fund applications out to the clients, we've actually gone back to the snail mail process and utilize volunteers to help us do that. That was a side note, but House Bill 945 will not affect any current fuel fund procedures. At present, we accept a verbal or written, that would be an email statement from a client or their proxy, that the client has a qualifying medical condition when considering a client for critical medical needs support from the fuel fund. We very much want to be a partner in the solution to protect critical medical needs patients, especially those over the age of 60, stay safely connected to the power they so desperately need during a health crisis. So on behalf of the Fuel Fund of Maryland, I respectfully urge a favorable report for House Bill 945. Thank you once again for the opportunity to testify.
Thank you. Robin Lindenberger.
Hello, can you hear me? This is Robin Lindenberger.
Yes.
Hi. Yes, we work at Maryland Oncology as a patient advocate, and fortunately, we are able to get the physician certification completed. But I am in favor of House Bill 945 because the population of 60 and over with the COVID pandemic and other medical conditions have not been able to get transportation to a doctor to get this certification filled out. A lot of them don't have the technology to do virtual visits. And I just believe it would benefit these people most vulnerable if approved.
Any questions? Seeing none. Eileen O'Connor Liebman.
Hi, good afternoon, Chairman Davis and members of the House Economic Matters Committee. My name is Eileen O'Connor Liebman. I'm one of the patient advocates here at Maryland Oncology Hematology in Columbia. And we are definitely in favor of House Bill 945. Like I said earlier, with the inception of the pilot of the critical medical needs program, I would say probably 85+% of the patients that we process applications for have been in the 60+ age range demographic. For them to, it's a bit of a struggle, especially when they are ill and sick, to be able to navigate that piece. A lot of them don't want to bother any of their children, their friends or siblings, to make them feel inadequate or not able to process certain things that come very common to us as far as email or a Zoom or a call or televisit, or even to get an email to print it. A lot of them don't have access to anything like that. And to be able to have the navigators in place to be able to assist with that is such a key component. And it's vital, to this process to have the navigators in place automatically, and instead of having to go back and forth with the paperwork. Our office, like Robin had stated, we're very passionate about it, and that's on the top tier to be able to get done, because we know the importance of it. Most doctors' offices, first off, they may never even seen it, but at this present time, with the offices having staggered staff, many are working from home, reduced office hours. Some primary care offices don't have all of their offices open at full staff at all. So that, adds another challenge to, what this, that demographic is, dealing with another barrier. So I believe that this would, take that barrier out and allow them to have all the resources and the benefit of this program. So we are definitely in favor of House Bill 945.
Thank you very much. Last witness on this bill, Laurel Peltier.
Hi, Economic Matters team. I'm Laurel Peltier, and I am honored because I get to be a navigator at the CARES program up in Baltimore City. I really started with energy supplier stuff. That's where you recognize me from. But during COVID, as you know, all of the OHEP offices, the majority of them are closed for in-person visits. So we realized there were a lot of folks up in Baltimore City who needed to manage this OHEP process, which is extremely tough. It's so tough that I'm going to be sending you all a 4-minute video on how to fill out the application correctly. But in all of this, I got to know the critical medical needs program because occasionally somebody would come, and I'm going to give you an example of getting a doctor's cert. So a gentleman who's hysterical, he's 74, he makes $780 a month, he has one eye, and he would come. I mean, he has no tech, no car. He used to be homeless, but he has an apartment and he needed energy assistance desperately because he had a cutoff notice. But he wouldn't come on time. And finally, I was like, why aren't you coming? And he said, I can't leave the house if it's hot because I have such bad COPD. I have to be in air conditioning. And I said, oh, dude, you're critical medical needs. And then I read, oh, I got to get a doctor's cert. And he says to me, Laurel, healthcare for the homeless. And I realized I need to get a doctor's certificate from Healthcare for the Homeless. Are you ready for this? 4 calls, 3 faxes. I got to know the director of records so closely because I was going to get that physician certification if it killed me. It was pure tenacity. I am a volunteer. It took me 4 weeks. And when that physician certificate came across the fax machine at our community center, I am not kidding you. Everybody was like, it's here, because I am waiting for this one piece of paper to go along with this application. And here's a shout out to OHEP. When I sent in his complete application with this doctor's certificate that took me 4 weeks, it was processed in 1.5 hours. And Mr., I can't say his name, got his OHEP and he now has power. So this is a great bill. These older folks, this is really tough, and I'm super in favor of it. Thank you.
Thank you very much. That concludes our bill hearing for House Bill 945. Members, we've had the notice now to head back to the floor. So once at the immediate conclusion of the floor session, we will come right back and get started with House Bill 641, Delegate Polokovich, and we will hear House Bill 221 and 168. What I'm going to do with that, because those bills are substantially similar, I'm going to let each of the sponsors testify, and then the witnesses are pretty much the same, so they will be testifying on both bills at the same time. So with that, the hearing for February 11th will be suspended until the conclusion of the floor session. Thanks, everybody.
Hi, Chris.
Oh, hi, Mr. Schwartz. So, wow, they're gonna beat me up because you're not supposed to talk during the while we wait for them to come on. But I don't think anybody else is on as of right. Yeah, they're all in a hearing right now. I should have told you this. I hopefully my guy reached out to you. But so they should be returning. All the delegates at least should be returning by roughly around 4 o'clock or 4:05. So we're just chilling for now. And Mr. Schwartz, you are muted. I know they don't want me to use the chat, so I'll text you.
I don't know how that happened. Were we the first one up?
I believe it's our bill combined with Delegate Ivy's bill, same bill. And then, yeah, it's just we testify and keep it moving.
All right. Usually they give you, mine is like 20 minutes. Is that right?
Oh, to testify?
Yeah.
No, it's just 2. Forgive me if I did not say that.
No, it's
No,
all right. I have 1 minute, 1 minute and 20 seconds and we'll be good.
Cool. Perfect. All right. Thank you so much, Chief.
I'll mute until we're ready.
You got it.
Hello, anybody can hear me?
We can hear you, Veronica.
Oh, okay. Are we ready? Are we ready? Are we on or what? I guess we're not, huh?
Not yet.
Delegate.
Oh, okay. Thank you. Thank you. I done ran up here. I'm ready. Now. Not yet. Okay. Okay. Okay, let me get my stuff on.
Kayla?
Yes.
I believe the chairman is ready whenever you can.
We're already live.
We're already live. Okay, thank
Yes.
you.
Mm-hmm.
Good afternoon, everyone. I'd like to welcome you back to the House Economic Matters Committee. Today is February 11th, 2021, 4:10. We have 3 bills remaining. The first being House Bill 641, if Delegate Polokovich Carr is with us. Oh. I tell you what, the delegate is held up, so we'll go to House Bill 221 and House Bill 168. I'm going to bring up Delegate Turner first to present her bill, then Delegate Ivy to present his, and then I'll go to the witness list since they are substantially the same. Delegate Turner. Unmute yourself, Delegate.
I got this now. I got it now. Thank you, Mr. Chairman. I'm ready now. Okay. Okay. Thank you, Mr. Chairman, and greetings to my fellow committee members. For the record, I am Delegate Veronica Turner, and I am bringing before you House Bill 221, which seek to prohibit the use of credit history when setting rates for auto insurance premium during the virus pandemic. The OAG reports that during economic downturns, people have little control over the negative impact on their credit. Considering the thousands of Marylanders who has lost employment due to the pandemic and have seen their credit scores drop because they can't afford their rent, the car note, their credit scores drop because they can't afford the rent, the car note, the utilities, the medical debts, and other bills. This is not the time to hammer them with higher insurance rates for credit scores that are out of their control. Continuing to follow credit history to be used when setting car insurance rates The Maryland is so economic discriminations. A Federal Reserve Bank study presents to Congress showed that the practice of using credit scores in insurance rates disproportionately impact minorities, younger workers, and those in the lower income communities. It is no surprise then that the jurisdiction with the highest car insurance rates are Prince George's County, Baltimore County, Baltimore City. These jurisdictions can contain some of our poorest and our most diverse population, yet on average, they pay the most for car insurance. Our current law allows auto insurance companies to use non-driving factors like education, income, zip codes, and credit history when setting rates. The Washington Post recently reported on this issue in an article called Auto Insurers Unfairly Set Rates Based on Drivers' Education and Occupations, where they go on and they said that the poor credit scores would increase a driver's premium by $500 to more than $2,000 annually, in comparison with drivers with identical driving records but excellent credit scores. Essentially, someone with multi-DUI but great credit will pay less than someone with poor credit and a perfect driving record. This is backwards and is wrong. Undetermining the entire point of the insurance prices, which is to rate risks. Insurers should focus on data directly related to the drivers, as such a move would strengthen the incentive for all motorists to drive more safely. Maryland needs to abolish the use of credit history as well as other non-driving factors in auto insurances. 7 states include Hawaii, California has already banned the use of credit history, and 26 other states and DC has introduced legislation in this direction. With this proposed amendment that were provided to the committee earlier this week, HB 221 with the amendments seek to address the negative effect of the COVID-19 on credit histories by eliminating the use of credit history during the pandemic. The sunset when appropriate. There will be testimony in opposition to this bill by the insurance companies. However, the pandemic calls for measures that provide release, if only temporarily. My panel will explain further for the reason we need a favorable report on HB 221 with the amendments. Thank you, Mr. Chairman.
You're welcome. Delegate Ivey's in a voting session in Ways and Means, so I told him if he arrives before it's over, I'll let him testify. But in the meantime, I'm going to go to the witnesses. Some of them are similar, but I'm going to call each. So know that for those who are being called, you're testifying potentially on both bills. If you're signed up for both, you're testifying for both right here. If you've only signed up for one, then just make note of which bill that you are speaking to. So we'll open up with Jan Kleinman.
Yeah, hi. Thank you so much, Mr. Chairman, and thank you, delegates. I'm Jan Kleinman. I live in Baltimore, and I'm a member of SURGE Baltimore, which is showing up for racial justice. And we are in support of House Bill 221, so ably introduced by Delegate Turner. She mentioned that there are several variables that are used to determine auto insurance rates. Some of them actually are reasonable, like gender. Research has shown that young adult men tend to be risk takers more so than young adult women. So that seems like a logical criteria for choosing auto insurance rates. But credit history, what does credit history reveal? I happen to be a 60-year-old married woman. I have decent credit history and I am not a good driver. I just was in an accident of which I'm very embarrassed. Car came from the right, I didn't see it. The point is, what does my credit history reveal about how I drive? It doesn't reveal anything. The converse can also be true. A person with poor credit history might be a very good driver. Indeed, that person has every incentive to be a good driver because they don't have as much disposable income to cover the cost of any accident. Delegate Turner introduced so many good points about income disparities and how people of color tend to have lower income and tend to pay these higher rates. I would just add to her argument that people who can't afford to own a car because their auto insurance rate is too high are forced to take public transit. You're all well aware of public transit in Maryland, and it isn't good enough to get you to every possible job that might help you raise your income. So you'd be limited in how you can get yourself into a situation to improve your credit history. So I urge you to support House Bill 221 and join those states that have banned the use of credit history in determining auto insurance rates. Thank you very much.
Folks, just to clear the record, unless I'm mistaken, I believe Delegate Turner's bill with the amendment she is submitting would only apply for 2021 and 2022, I think, and then it would sunset. I think it's applicable because of the pandemic. If I understood her correctly, she was saying it, and it makes perfect sense, to be quite honest. Because of the devastation that's been caused by the pandemic, it is very likely people who, for whatever reason, I mean, however we feel about credit in this, they likely would not be in the situation if it weren't for the pandemic. So they're going to be adversely impacted by something through no fault of their own. Now, we've always been told that credit is a good barometer for whatever reason. And while I'm not here to argue that today, what I am hearing the delegates say is that she wanted to essentially eliminate that for the next 2 years, in light of the fact that a lot of people who otherwise would not have a negative credit history very well have one now and then be subject to a negative rating solely because of COVID-19. So I wanted to make that clear what was being posed. Michael DeLong.
Thank you, members of the committee. My name is Michael DeLong, and I'm a Research and Advocacy Associate. I'm here on behalf of Consumer Federation of America. Consumer Federation of America is an association of over 250 organizations. We were founded in 1968 to advance the consumer interest through advocacy, research, and education. We support HB 168 and HB 221. We think that ideally the use of credit information in auto insurance rates should be banned. Americans think that the cost of auto insurance should be based on your driving record and actions, which means whether you're a good driver, whether you have any tickets, any accidents, or drunk driving convictions. But auto insurance companies use numerous socioeconomic factors to unfairly discriminate against consumers and charge them higher rates. Credit score is one of them. It has a very harmful impact, especially in Maryland. To give just a couple of examples, we recently acquired data on auto insurance premiums, including premiums in every zip code in Maryland. In the zip code 20901 in Silver Spring, we found that drivers pay an average annual premium of $962 if they have excellent credit. But if they have only fair credit, their premium shoots up to $1,295. And if they have poor credit, it goes up even more to $1,672. That's a big increase of like about 74% more than if they had excellent credit. And when we apply the same situation to zip code 21216 in Baltimore, the problem's even bigger. The average annual premium, if you have excellent credit, is $1,760. If you have fair credit, it goes up to $2,399. And if you have poor credit, you have to pay over $3,000. The use of credit scores leads to higher premiums for drivers. It can make auto insurance unaffordable. It contributes to racial bias and systemic racism. And the legislature requires that auto insurance be bought for drivers. And so it has a responsibility to ensure this product is affordable. I urge you to support both of these bills and appreciate the delegates' work on this issue. Thank you.
Fran Schneiderman.
Thank you, Chairman Davis, members of the committee. My name is Franz Schneiderman. I'm with Consumer Auto. We work on safety and fairness and transparency for Maryland car buyers and drivers. You know, we strongly support this bill because we think the use of these credit scoring as a factor here is deeply burdensome, both to low-income people and to people who suffered an economic reversal, due to layoff or a medical bill that hurts their credit rating and causes their car insurance rates to then go way up. And obviously that's particularly a bigger problem in these pandemic times. The cost of car insurance, the use of credit raises the average cost by more than $1,000 for people with poor credit rating. That's just a huge burden for a product that the state has more or less mandated that people buy because you have to have it to drive legally. Now, insurance people say that it's connected to the number of claims filed, but we don't let people discriminate on just any basis that you can say is statistically correlated. They can't use race and other factors. I think it's unfair to use credit. It's unfair to lower income people who it makes very difficult to afford insurance. It's unfair to people who've suffered an economic reversal or giant medical bills that hurt their credit rating. It's unfair because credit ratings are notoriously inaccurate and there's a lot of inaccurate information. And it's also kind of irrational from a public safety standpoint because there's a huge interest in safety on the roads, and using a factor like credit, does nothing to promote safe driving patterns or reward people for driving safely. I know this is the sunset after over 2 years, but I'd hope, once we pass the law, the principle might be extended. A lot of other states have now prohibited the use of credit. I'd love to see Maryland join them. It would be fairer to low-income people and better for public safety on the road. Thank you.
Christopher Dews.
Good afternoon, everybody, and members of the committee. My name is Christopher Dews. I'm a policy advocate for the Job Opportunities Task Force, where our mission is to help lower wage workers advance to higher wage jobs. We support House Bill 221 with the COVID-19 amendment as a means of decriminalizing poverty and making sure that auto insurance rates are more affordable, specifically for lower income workers who are our constituents and job seekers who have limited access to good credit during the pandemic. As the delegate had already mentioned, the Washington Post released an article discussing how non-driving factors like occupation, zip code, and credit history disproportionately hike up rates for lower income people, Black and brown communities, and just generally people who don't deserve it. To be specific, it stated that the driver's annual premium will increase by $500 to more than $2,000 in comparison with drivers of identical driving records but have excellent credit scores. I also want to mention that the Consumer Federation of America, as we have a representative already on the call, a 2013 study stated that for F&C coverage, State Farm charged individuals with poor credit 166% more than those with excellent credit. On the whole, on the national level, it's 123% more. So generally speaking, for those who have lower credit, you're paying double what somebody with higher credit would pay. We think that this is incredibly unfair to our lower income workers, specifically during this pandemic, when people have less access to credit because of their overdue rent payments, overdue car notes, and all other different types of things. We also want to acknowledge, and this is the last thing I'm going to say before I close, that 50% of Marylanders have to drive cross-county for work. That was reported by the U.S. Census Bureau. That only 55% of Marylanders can telework. Only 45% of Marylanders can telework, which means the vast majority of Marylanders have to drive in order to make it to work. And as of right now, the way that our legislation is designed, if you don't have auto insurance and you need to drive to work, you can find yourself incarcerated thanks to Maryland Code 16-303. So for those reasons, we want to lower the cost of auto insurance and eliminate the use of credit history in auto insurance rates. And for those reasons, we thank you and we urge a favorable report. Thank you for your time.
Thank you. Isidore Stern.
Good afternoon, Mr. Chair, Madam Vice Chair, and members of the committee. My name is Isadora Stern, and I am here today with the Maryland Consumer Rights Coalition. MCRC is a statewide organization that works to advance economic inclusion and justice for Maryland consumers through education, research, our advocacy, and direct service. We are in support of both HB 221 and 168 because the use of credit in auto insurance rating perpetuates socioeconomic discrimination. Auto insurance underwriting should be based solely on driving-related factors that assess the risk a driver poses on the road and not factors that are a better indicator of socioeconomic status rather than their driving ability. Insurance companies can't use factors like race and income to rate policies, but through the use of non-driving related factors like credit, they have found a way around this and continue to more covertly discriminate. And credit is one of the most egregious factors that disproportionately impact low-income drivers, working families, and drivers of color. Credit can it can greatly increase the cost of an insurance policy. We're looking at drivers in Maryland who, some of them with a DUI but an excellent credit rating, will pay $1,600 less than someone with a perfect driving record but with poor credit. So this isn't keeping our roads safer, it's just punishing poor people. The use of credit has been examined in other insurance underwriting, and in Maryland it's illegal to use it in home insurance because it was found to be discriminatory. And as the delegate indicated, the use of credit in auto insurance has been made illegal in several other states. The cost of insurance in Maryland is incredibly expensive, and it's creating a population of drivers who can't afford to be insured. We have over 700,000 people in Maryland driving without insurance. We need to be creating policy that addresses the affordability of insurance. So please consider passing this bill with a favorable report. Thank you.
Thank you very much. Robert Enton.
Thank you very much, Mr. Chairman, members of the committee. Robert Enton on behalf of the American Property Casualty Insurers Association. Our members write roughly 60% of the automobile insurance in the state of Maryland. We are opposed to this bill. I don't know how many times now I've testified on this bill. I testified on this bill back in 2002 when it passed. It was House Bill 521, and Mike Bush was chairman of your committee. It was a controversial bill then. It affected homeowners insurance and car insurance. A compromise was reached with everyone. And I guess what's this 19 years ago. And this bill, I think, has stood the test of time. There are only 3 states in the entire country that ban the use of credit for automobile insurance. Those states are Hawaii, California, and Massachusetts. What we did in Maryland was take a balanced approach. So you've got the 3 states that outlaw it. You've got Maryland, that's 4. And then in the rest of the country, there's not another single state that in any way restricts the use of credit for automobile insurance. And I think that's because historically, every study that's been done shows that it is a valid and very important determinant of the probability of having claims. That's what the actuaries show. In the state of Maryland, we've got a very clear statute that talks about underwriting. You cannot underwrite or renew a particular insurance risk or cancel, refuse to underwrite or renew a particular insurance risk for class of risk based wholly partly on race, color, creed, sex, blindness of an applicant, or for any arbitrary, capricious, or unfairly discriminatory reason. That's the Maryland law. And if in fact there was a allegation made to the MIA that an insurer had violated that, and that it was discriminatory, it wasn't based on sound standards, then the MIA would issue an order and tell them they can't do it. That's never happened in the state of Maryland. I see my time is up, Mr. Chairman. I just would like to say that I want to make one thing clear, respond to one thing that was said. Under the Maryland statute, you can't do anything once you've rated the initial policy except lower the premium based on an improvement in the score. You have no ability under Maryland law whatsoever to increase a premium once you've written the policy because the score has gone down. And frankly, it's our understanding from TransUnion and the other credit scoring agencies.
You're really stretching it here.
Okay, and right now to say that that our information is the credit scores have not gone down, and that credit scoring is now heavily regulated under the CARES Act. Thank you, Mr. Chairman.
Just a reminder to folks, the chat is only for the members for us to communicate to each other. It's not to provide additional testimony or to debate back and forth for what you're hearing. So only members of the House Economic Matters Committee should be using the chat. Thank you very much. Bob, I do have a question though, and which is why I very early on I was trying to make clear what I was hearing. There's a lot of things that are being sort of flipped upside down because of the situation that we're currently in. Even you said it hasn't happened yet, but there's got to be some new policies that are going to be written. You know, if for no other reason, kids are turning 16, 17, 18, people switch companies, the whole bit. If credit is used in light of the pandemic, doesn't that sound, I mean, even if it's just one of the factors, isn't that wildly misleading?
You know, Mr. Chairman, I would just say that under the CARES Act, there are very strict provisions about credit scores and credit scoring for TransUnion and the other companies for what's happened during the pandemic. You know, we have a very, very, very competitive market in the state of Maryland. We have dozens and dozens and dozens of companies that write insurance, and we don't have any anticipation. I mean, the last thing that we want to do is not write a policy. Once again, if you have the policy with us, we cannot increase the premium because your score has gone down. We can't do that. So
what if I'm coming from a different company to one of your member companies? Wouldn't they be able to use my score that's been adversely impacted by COVID? At that point, I'm not talking about a renewal, but I'm talking about a new policy.
Okay, so let me say this, Mr. Chairman, that first of all, under the Maryland statute, there are very strict limits on how much how much you can have, you know, how much swing you can have in a policy when you initially write it based on credit score. So, you know, and once again, we don't anticipate that because of COVID, that credit scores are going to go down. That's not what we're being told. That's not what the CARES Act provides. So if you're going to change, I'll say two things. If you're going to change companies, then I think there are going to be a lot of people out there that are going to want to write that new business and want to compete against each other for that new business. The credit is only one factor that's used. You know, there are some companies have 75 or 100 factors. It's a complicated business. Credit's only one. And I don't think the companies are going to want to turn that business away because you had a temporary decrease in your credit score.
I'm talking, Robert.
All right. Let me go to Delegate Charkouti and then Delegate Walker.
Thank you, Mr. Chair. Thank you, Bob. It's always good to see you and to have the history of how we've considered things over time. So I guess if I understand, I've now been listening to a few years of testimony around insurance, and I think I understand that your position is that our laws currently allow you to select and use characteristics that would increase the likelihood of claims, not the likelihood of accidents or problems on the road. Is that right?
Yes.
And
I
so
mean,
it's your,
let me take that back. Credit, I think, I know, and there are other witnesses who have more expertise probably than I do. We have an actuary who is signed up to testify, and this is what he does for a living. But I think that the use of credit is an indicator, and all the scientific studies and studies that have gone on in multiple states since 2002 all demonstrate that credit is a good predictor of claims. Now,
Yeah.
driving habits may be a good predictor of whether you're going to have an accident or not. So I think that my understanding is that that's part of the issue, but I think some other witnesses may have more knowledge on that question than I do.
So I fully trust that there are actuarial studies that connect credit to claims. I would be shocked, and I'd love to see it, if there are scientific studies that connect credit to driving ability. And I would love for someone to share it with me. The reason I ask that is because I wonder if what you're pointing to is a need to change the fundamental structure of if the basis of all of our laws around what you can set your policies on allows discrimination against poor people who are more likely to file claims because they can't afford to fix their car on their own, then maybe it's the entire structure that needs to be changed. So that's where I'm trying to understand, is that your position, is that we have, at this point, it sounds like you're saying that someone who has less access to income, which, lower credit scores often are tied, not exclusively, but they're often tied to people who have less income because they've struggled, and ended up in debt. So they would be more likely to file for a claim because they can't just go and fix a $200, $300 thing on their own. So that all makes sense to me. I would say that the social science research probably backs that up. So are you saying that we ought to be able to continue to discriminate against poor people? We don't discriminate against race, although the issues are correlated, but we should be able to discriminate against poor people in the way that we write our policies. Is that your position?
No, ma'am. It's not at all my position. I think once again that, whether you're poor or you have median income, what we find is that the credit scores that we look to are a predictor of the number of claims.
Can you imagine?
It applies across the board. We don't say if you have an income of X that you're going to get a lower score. So no, that's not what I'm saying at all.
Okay, but what you are saying is if someone is more likely to file a claim, then you should be able to charge them a higher rate. Is that right?
I think that's one of the many, many factors that we take into consideration. Yes.
But it is a factor that you think ought to be
It is
allowed.
a factor, yes, because it's actuarially sound and it is a predictor of loss. And I don't agree that it's an indicator of race or necessarily income level. I don't believe any of the studies show that.
Well, there are studies that show actually that credit rating is correlated with race and with income level. So there are studies that show that. So we could get them to you if that would be helpful.
It would, and I'll get to you the studies that say that's not the case.
All right, guys, we're getting real close to being argumentative here. So let's see if we can just do the Q&A, and then I'll go on to the next members who have questions. The floor is yours, Delegate Charkoudian.
Oh, sorry. No, that was the end of my questions. Thank you, Mr. Chair.
All right. I'm going to go to Delegate Walker. After we finish with Mr. Enton, I see Delegate Ivy has joined us, so I'm going to let him testify after.
You can have him do it now, Mr. Chair, if you would now, because you may answer my question.
All right. Delegate Ivy, if you will.
Thank you so much, Mr. Chair, and to the entire committee for the work that you're doing on this and on so many other pieces of legislation. For the record, Delegate Ivy here presenting House Bill 168, which is an identical version of a bill that you just heard proposed by a member of your committee, dear friend, Delegate Veronica Turner. This piece of legislation would make a small change that is a very a good change, I'll say, which would make it so that auto insurance companies are no longer able to use your credit history when they're assessing their premiums. As you've heard from other individuals who have just come and spoken, these discriminatory policies allow for auto insurance companies to punish Maryland's low-income drivers for being poor and rewards bad drivers for having access to credit. And so I hope that you move favorable on this piece of legislation. House Bill 168 is also cross-filed with Senator Young's version of this bill. Thank you very much for your time.
Did the chairman step out? Maybe. All right, Delegate Walker, why don't you ask your questions?
Sure, thank you, Madam Chair. It'll be one. First, let me ask the sponsor, Delegate Ivy. So you put in this legislation because you saw a problem. This does happen.
Absolutely. Absolutely. In my district specifically, I've heard so many different stories of individuals who just had massive payments for their car insurance. And the rationale behind it is they didn't have the best credit history. So right now, during this pandemic, there are just so many different needs that people have, and we're trying to just find ways to lessen the burden across the board. And for our lower income communities, many individuals that I represent, this would be a very huge help right now as we're already struggling through so many different.
So, Delegate, why do it during just the pandemic? Doesn't it seem like, the minority communities have had lower credit scores for years? I mean,
absolutely.
You just say you want to do it for this short period of time.
Oh, no, not at all, Delegate Walker. This bill has been proposed before, and I hope that this committee passes this bill this year, and our colleagues across at the Senate move and do the same thing. I think that this pandemic has really shone a bright light on many of the discriminatory practices that take place here in the state of Maryland. It's made us see inequities up close and personal. So it's not a new idea, and it should not be temporary. But nonetheless, if you all would like to put a sunset provision in or something like that, just so we can show you that this is not going to cause the sky to turn red and for the whole earth to end. This is something that the insurance companies will be able to weather.
Thank you. Mr. Etten, are you still there?
Yes, sir, I am.
All right. Simple question. Obviously, I'm kind of new to this committee here. I mean, what in the world does my credit score have to do with auto insurance, with my ability to drive?
All the actuarial studies show that your credit score, we call it your insurance score. Your insurance score is a indicator of whether or not you will have claims during the term of your policy. That's what the actuaries show. We don't make it up. And those actuarial reports are filed with the Maryland Insurance Administration. And if the Maryland Insurance Administration believes they're not actuarially sound or they're unfairly discriminatory, then they will not allow it to happen.
Yeah, I got you. Thank you. Thank you, Mr. And thank you, Mr. Chair. I'm shaking my head on this one. I did not know this existed. This is maybe because I'm from California, so they didn't do stuff like that. That's all right.
Anyone else? If not, I'm going to go to Roosevelt Mosley.
Thank you, Chairman Davis and members of the committee. My name is Roosevelt Mosley. I'm a principal and consulting actuary with Pinnacle Actuarial Resources, and I'm providing testimony today on behalf of APCIA in opposition to HB 221. Automobile insurance companies use many different rating factors, as has been stated, including credit-based insurance scores to determine the relative cost of insurance for policies with different expected losses. And in most states, insurance companies have to file and justify their use of rating factors with regulators. The primary way that companies do that is by demonstrating the validity of these factors based on their own loss experience. This loss experience is tied not just to the likelihood of filing claims, but is also tied to the likelihood of accident behavior. And so this analysis, the analysis of this factor generally occurs in a multivariate fashion along with other risk characteristics. And the reason this is done is it ensures that credit-based insurance scores aren't overlapping or giving you similar information that other driving-based elements or other related elements that companies are using would give you. So ultimately, the use of credit-based insurance scores results in rates that are more reflective of loss costs. Now, if this bill were to pass and this particular factor was removed, one of the results would be significant rate disruption. Obviously, policyholders currently paying lower rates due to credit scores would see an increase. And then these increases would subsidize the lower rates paid by policyholders that now pay lower rates. And generally, the common assumption is that all the policyholders that have higher credit scores are the higher income, non-minority policyholders. The reality, based on studies that have been done, is that the reality is much more nuanced than that. And what you would see is there are policyholders, minority policyholders, there are lower income policyholders that have good credit scores and would be impacted by this particular bill. I'll end by saying we all want the insurance system to be fair and sustainable. And efforts have been initiated by NCOIL and NAIC to study this issue and to develop solutions to address it. And we believe that ultimately this collaboration between companies, legislators, regulators, and consumer representatives to address this issue in a comprehensive manner versus a one-off manner, which may not get to the right, ultimately to the solution that legislators are looking for. And so with that, my time is up. I appreciate the opportunity to give you this testimony and would be happy to answer any follow-up questions.
Delegate Crosman.
Thank you, Mr. Chair. Mr. Mosley, if you could just talk for a second on the states that did remove credit reports or credit history from the auto insurance policy. What happened there? And if you could talk, about, was there an immediate disruption and then it kind of leveled off and now they're paying higher rates across the board, or is it something different?
So actually, of the states that were mentioned, California, Hawaii, and Massachusetts, those three states actually never allowed credit score. And so it wasn't a case where it was in and then removed. The only situation I'm aware of where credit score was used and then removed was as it relates to Maryland homeowners. And so ultimately, there have been some that have looked at that particular situation, and essentially there were a couple of things that did happen. There were obviously the rates shifted and adjusted for those with better credit. The rates went up. For those with worse credit, the rates went down. And I believe also, if I recall correctly, there was at least one company that ended up leaving the state partially as a result of this as well. Michigan, actually, there was an attempt as part of the reform legislation that was passed last year. There was some discussion about removing credit-based insurance scores from rating. It ultimately wasn't taken out of Michigan. And so that would have been the next test case, but ultimately it didn't happen.
Okay, thank you.
Sure.
Delegate Watson. Delegate Watson, you're muted.
Sorry about that. Thank you, Mr. Chair. Mr. Mosley, I wanted to follow up on a couple of things that you said. First, I just want to make sure I understood you. Is credit score, you said it was highly correlated with both behavior and number of claims?
That is correct. And that's been actually shown in a couple of different ways. One is it really, there was a discussion earlier about the lower credit scores and a higher propensity to actually file a claim versus not. And it goes beyond that. It's actually a higher likelihood of causing accidents. I'm sorry.
So in terms of turning in claims, if someone doesn't have a lot of income and they have good credit, but they don't have a lot of income, they still are going to turn in claims if they don't have income to cover that $500 loss, for example. So like, I'm trying to understand, if you take away the ability to use credit, you're still going to have people. Is it true that you would still have people with lower incomes? Do people with lower incomes turn more claims in, is I guess what I'm asking, regardless of credit?
Well, and so I can't necessarily answer that particular question directly because we've never done a study that looked at income and the likelihood of filing claims. That's one of the factors that companies do not use and are pretty adamant about not collecting. I will say that in that particular scenario, as an example, depending on the thresholds in particular states, if you've got someone with good credit and who doesn't have the financial ability to cover a $500 claim, again, removing credit score essentially as two potential issues. One is that they remove the discount that they would be receiving, and so their rate goes up. And then in most states, companies are allowed to surcharge for prior claims that are filed, so the rate goes up as well as it relates to that. And so in that situation, at least they would have the benefit of their better credit score and the discount applied.
So isn't it true that the number of claims someone has is probably the most, has the most impact on their rate of premium increase? In other words, the more claims you have, the higher your premium goes.
That's, yes, generally. It's generally the case. There are some limited exceptions, but generally the case is the number of prior claims you've had in generally the prior 3 years. The more claims you've had in the prior 3 years, the higher your rate will go, yes.
So if you wanted to help us reduce what we may see as discrimination against people with lower incomes, what factors would you tell us to look at?
Actually, and one of the approaches that's even been laid out by one of the consumer groups, the Center for Economic Justice, and I think the approach makes sense. The approach there really isn't on a factor by factor basis, because ultimately this isn't a factor by factor issue. If there is bias in rating, it's much more complicated and nuanced than that. And so my recommendation would be to one, define what it is we're trying to address. Secondly, let's do the research to make sure that we are identifying the problem specifically. And then thirdly, come up with solutions that deal with the holistic issue and how to address it. Because ultimately, if credit-based insurance scores are taken out, that it isn't just a credit-based insurance score problem. I'm not saying credit-based insurance scores are a problem, but if credit-based insurance scores are taken out, it doesn't necessarily mean that everything is fine and the auto insurance world is a perfect place then.
Okay, and last question. There are companies that many companies, probably most companies now, use a lot of different factors at once in a model to come up with the pricing. Is that right?
That's correct.
So credit scores is one piece of that. And if you pull that out, what you're saying is you may not get what you think you're getting because you don't know how it's interacting with the entire model.
Well, I guess ultimately, backing up one step, generally the way companies analyze credit score, they usually analyze it in a way that makes sure it adds additional value over and above what they're currently using. If all credit score did was just replicate what a company already had, they wouldn't pay to actually use credit scores. And so when you pull credit score out, ultimately you end up with a loss prediction model that is going to be less than optimal.
Okay, thank you. Thank you, Mr. Chair.
Sure.
Delegate Crosby, are you left over from before, or did you have a question?
I'm sorry, Mr. Chair.
Just checking. Didn't want to miss you. If there are no other questions for Mr. Mosley, then let's go to Andrew Kirkner.
Thank you, Mr. Chairman, members of the committee. Andrew Kirkner on behalf of the National Association of Mutual Insurance Companies. Appreciate the opportunity to be back before the committee today to talk about these important bills. NAMIC is requesting an unfavorable report on both bills. I guess Mr. Mosley's testimony was very helpful, I think, to many, including myself, to better understand how credit-based insurance scores are used. I did want to talk just very briefly about two things that the committee has heard so far and clean up the record a little bit. If the goal is to lower the cost of auto insurance, I would just caution the committee that this is not the way to do that. There is no indication, no evidence that would support that making risk less accurate to determine would then lead to lower insurance rates. In fact, I think the logical inference is the opposite. The other thing, very briefly, that I'd like to touch on is the impact of COVID-19 on credit scores. Just in October of 2020, so just a few months ago, the United States hit its highest ever average credit score. And so it's not that people aren't suffering impacts of COVID-19, they certainly are. It's not that there isn't an economic downturn, there certainly is. But when we talk about credit scores, it's very important to make sure we're operating, I think, off of accurate information. And the accurate information is that credit scores are as higher, in fact, average credit scores than they've ever been. The final thing I would like to point out just before turning to my prepared remarks is what the insurance industry has done in response to COVID-19. Across the industry, the P&C industry, our companies have returned more than $10 billion in premium. And I believe at last check with the Maryland Insurance Administration, the number in Maryland exceeds 500 million in premium returns to consumers. So hopefully that sets the tone. Mr. Chairman, just very briefly, I would like to point out the substance of a credit-based insurance score. The reality is the scientific studies that have been done on the credit-based insurance score tell us that it is predictive of risk. Georgetown in 2016 put out a comprehensive study that discusses each of these studies in detail. I would encourage members of the committee to take a deep look at that study, which provides an overview. So we know that credit is predictive of risk, and that is insurance risk. Mr. Mosley just delved into that a little bit. I'm happy to try to answer any questions I can, but we know that it's predictive of risk. Two, we know that credit-based insurance score is not a proxy for race or income. We know that from a number of studies, but two that I'll highlight here today. The Federal Trade Commission in 2007 produced a study that said, after looking across a number of claims across, I believe, 5 major insurers, that credit-based insurance score is not a proxy for race. Moving to income, there was some question after the FTC study whether credit-based insurance score was a proxy for income. Again, in 2016, Georgetown did a comprehensive study that said that credit-based insurance score is not a proxy for income. It did that in a couple different ways, and I'm happy to dive into those more deeply if anyone has questions. But finally, Mr. Chairman, I'd just like to close by saying that the elimination of credit-based insurance score as a factor in auto insurance, it hurts far more people than it helps. A 2017 study by the Arkansas Department of Insurance outlined that 80% of consumers, that's 80% of consumers, either received a lower premium or were unaffected by the use of credit-based insurance score. 54% of those received a decrease versus only 19.8% increase. So, Mr. Chairman, I believe there would be unintended consequences by the removal of credit-based insurance score as a rating factor. It would also hurt our smaller companies in being able to compete with the larger companies. And for those reasons, NAMIC urges an unfavorable report on the 2 bills.
Let me try this first. You say credit scores are as high as they've ever been. We got to keep in mind, though, the pandemic hasn't affected everyone. In fact, the overwhelming majority of people didn't lose a job, they didn't lose pay, none of that. So and you can sort of see that with the stock market. So it hasn't affected everybody. We're not here talking about everybody. We're talking about those who were impacted. I bet that they haven't had the highest credit score that they've ever had. So the focus is on that. Also, again, the bill, I have to keep bringing it up. It's for the bill with the amendment offered by the sponsor isn't to get rid of credit forever. It's for while we're in the midst of the COVID, the people that are being harmed. But we're fighting this tooth and nail for some reason. Mr. N testified earlier that there are 75 different factors, but this one seems to be the linchpin for some reason that, you know, all heck will break loose if we don't have this one. We got to have this one. Otherwise, there's a problem. You mentioned premiums being returned to people. That wasn't generosity. That was the MIA saying people aren't driving as much, so the risk isn't great. That was ordered by the MIA for that to be done. That's not what we were told. If that's not the case, some people, you're right, some people started on their own, but the MIA did order returns. If not, the information I was given was wrong. But beyond that, whether that to be the case or not, a premium return still doesn't justify or defend why in a pandemic, you know, we're about to offer businesses a huge chunk of money in the Relief Act and others. There's a reason why we're doing all of that. There's a reason why we are offering this, because we recognize these aren't normal times. So different times or drastic times call for drastic measures. Business as usual is no longer acceptable. So that's the point that we're trying to make here. However we feel about this, to plant that flag in the ground and go, we don't care that it's COVID. Credit has to stay in. And all of this talk, I mean, if we need assistance, if somehow credit is going to be problematic for our carriers, can our insurer may step in and provide some assistance? I think they can handle that if this is somehow problematic for our regular carriers to do. Maybe we need to take off the constraints that we have on them and ask them to step in and help to do what apparently cannot be done by the industry. But we have this, Bob mentioned that he was tired of it, so am I. So am I. I've been here, I got here right after Speaker Bush, former Speaker Bush, Committee Chair Bush in 2001. I took over in 2003, and we've had, whether it's the premium finance companies, and we've had nothing but these kinds of issues that, quite frankly, low-income people get the short of the stick about, and we're just told there's nothing we can do. And we've just about had enough of that, if I'm being blank, if I'm being straightforward and honest, and no movement whatsoever. I mean, there's not even a slight bend in position. I'm through with that. For me personally, I don't know about the other members, but I'm voting aye on this bill. Anyone else?
I got your back, D.
If not, Bryson Popham.
Boy, I don't know what to say, Mr. Chairman, but I'm going to deliver my testimony anyway. My name is Bryson Popham. I'm here today on behalf of 4 different clients, the insurance agents and brokers, the Maryland Association of Mutual Insurance Companies, Agency Insurance Company, and Progressive, a name the committee knows, I'm sure. I too was here in 2002. In fact, closer to this than anybody on this committee. I was standing in the State House lobby near midnight on sine die when the conference committee was working out the details of House Bill 521. Chairman Bush, then Chairman Bush, came out and spoke to me and my clients and said, "Do you write homeowners insurance?" No. That is why, as Mr. Mosley said, Maryland's the only state that has had credit for a line of insurance, homeowners, and then removed it. So I have fought these wars. I sympathize with Delegate Walker, and the other members of the committee who have a hard time understanding the connection between credit scoring and the propensity for future loss. That's really what it measures. Delegate Walker, I understand your question. I would point to a document that is in the committee's possession. I believe I'm holding it up now. This is an APCIA document. This is Mr. Enton's client, but one of my clients is a member of that association, and perhaps it will shed some light for you on it. All you need to do really is look at the two charts there, because it shows how credit is directly related to the propensity for future loss, and it ties it to behavior, which is the holy grail for those who are critics of credit. It ties it to a specific behavior called hard braking, which I think the committee will acknowledge. We can understand how that might create higher losses in the future. There's a direct connection there. It's laid out on this page. The data comes from one of my clients, and it's in your possession. I know, Mr. Chairman, you don't want to hear that credit scores have improved in the pandemic. They have for some, I agree. This is a problem for others, I agree. The problem is the high cost of auto insurance. You've heard it in this hearing, we hear it in every hearing. And the reason my other clients are opposed to this bill is they want to compete for business from your clients, from your constituents. Low income, high income, doesn't matter. They want insurance business. And the more competition we have in this state, the more insurance companies that are pursuing your constituents, the lower the rates will be. That's the only thing I know that will really have an effect on rates. We can do things artificially. I'm still opposed to this, partly because I don't understand how it might work. But I do know that if we can lower rates through increased competition, then everybody will benefit. And that is my testimony, Mr. Chairman. I'm happy to answer any questions.
Delegate Charkoudian.
Thank you, Mr. Chair. Probably if I knew what was good for me, I would stop talking after the chairman tells us that he's going to move the bill. But I am genuinely interested in understanding this piece, because I do know a lot about how multiple regression analysis works. I know a lot about how the studies work. I'm not an actuarial expert, but I do understand correlation. I understand causation. I understand how we set policy and how certain people end up getting targeted. And I fully understand that credit scores, zip codes, other things that would be tied to poverty would also be tied to the likelihood of filing a claim. I can fully understand that. And so when you say the likelihood of loss, as I understand loss, you mean the insurance company having to make a payment. Is that correct?
Yes, that is correct.
Okay. So that part of it I understand. And I'm not saying that it's not possible that these same things are also tied to people's driving behavior. I just am, and I'm looking for your study here. I'm not sure, maybe you could send it to me directly. I'm just trying, that makes sense to me scientifically, and it makes sense to me intuitively. What I'm struggling with is how those same things that are correlated with poverty and race, and we've talked a lot about all the ways that systemic racism gets baked into our system, and I think this is potentially one of them. I'm not following how that's tied to driving behavior, and I just can you send me what you're looking at? Because I keep hearing the connection to loss, but I'm not hearing the connection to safety and driving.
I am told it is in the possession of the committee. I'll make sure that you have it, Delegate Charkoudian, but it's part of the Mr. Enton's client's written testimony. It's a one-page document. Happy to discuss it with you. I just want to say one thing about your comments right there. You, I think, understand the difference between correlation and causation. That creates a lot of problems. Steve Larson, who was our insurance commissioner in 2002, Chairman Davis's predecessor as chair of this committee, said, even though he opposed credit and worked for its abolition and got it, he said there is a correlation between credit and the propensity for future losses. And that has been true of every single insurance commissioner we've had over the last 20 years. Now,
sorry, go ahead.
The word is correlation. It is not causation. Like you, I'm not an actuary. And I think that's what some of you and your colleagues are struggling with. And I can feel your difficulty understanding that.
Yeah, and so I guess from a policy perspective, it is our job to set what we think ought to be legit in the mix of what gets considered from an actuarial perspective. So we have said race can't be used, right? That's a statement
Right.
that we have made in the past, right? Okay, so it is within our purview to say the connections between credit score, the causation to loss, therefore the higher price, and the connections between that and race and poverty is such that we find it unacceptable to use that, even if it does predict loss. So I guess that's where, if it was predicting driving behavior and making us safer on the roads as well, which is part of what one would hope our insurance prices would do, I think we might be able to accept it more. But when it just seems to predict the likelihood of filing a claim and also raises the rates for the poorest of our community members compared to the wealthier of our community members, I think that's where it gives us pause. So I'll take a look at what you send me. I appreciate you being here. Thank you.
Thank you.
I just got a quick one, Bob. I mean, Bryson, you said something that got me to thinking. You said that there's a difference between causation and correlation.
Those are the words. Those are the magic words. It's difficult, I know, to appreciate this. And
No, stay with me for a second. Stay with me for a second. I got you. I just wanted to make sure I had you right. Causation, correlation. What if we looked at the numbers and, purely just through objective lenses, nothing else, and it appeared there's a correlation between a black driver and a white driver? Wouldn't you all want, I understand that the MIA doesn't allow it, and I understand why, but why wouldn't we fight for that? I mean, that's not racist. That's just what it is. If the numbers showed that black drivers were more likely to do it than white drivers, then why don't we just fight to allow black drivers to be charged more?
Here is my short answer to that question. You can't change the color of your skin. You can change your credit score.
While that is technically true, I also know that when you come from, or you're in difficult circumstances, oftentimes through no fault of your own, like a pandemic, it's easy to say, pull yourself up by your bootstraps, but real life doesn't always work out that way. I mean, I know you know that, but it's not so simple as just effectively saying work harder.
Mr. Chairman, I am not making the bootstrap argument. This goes back to the comment Delegate Charkoudian made a minute ago. You and your colleagues have the ability to set the policy of this state and the laws that you pass. And that is certainly within your purview and your power to do that.
No, I agree. Like I was just, like I said, I thought about correlations, and we can correlate in a lot of ways, but there's some things that we find objectionable enough that even if there is a correlation, i.e. race, we're simply not going to do that. Even if, I bet there's a correlation between certain races and driving for whatever reason. I mean, it's not a causation, just a correlation. I bet there's something like that, but that's been deemed taboo by society, so we're not going to do it. Poor people, on the other hand, there may not be enough advocates and champions for them to the point that it'll have that same effect as if we had the way we've had advocates for race. So that, it's just something I thought about. I'm not asking you to answer that question. That wouldn't be fair to you, but it's something that I would like, if nothing else, the members to think about, because we very easily could find a correlation with race, but no one would go down that road.
That's right. That's been prohibited forever, and it should be prohibited, Mr. Chairman. I don't think anyone disagrees with that.
But why should it be prohibited if there's a correlation?
Because we make decisions for other reasons, and we made a decision a long time ago that it is unfair. It's fundamentally unfair to rate a person based on characteristics that they can't change. And credit score is not such a characteristic. Driving record is not such a characteristic. The kind of car you drive is not such a characteristic. You can change all of those things. You cannot change your race.
Right. Delegate Pippy.
Thank you, Mr. Chairman. And just really quickly, I agree with the sentiment from the chair and Delegate Turner in that, we're always trying to reduce rates for people. That's a big thing, and I'm 100% in solidarity. Real quick for Mr. Popham, and you might have answered this, but does Pennsylvania, Virginia, West Virginia, Delaware, are they permitted to use credit scores in their auto insurance?
I'm not intimately familiar, Delegate Pippy, with their laws, but I believe that they are. Maryland's the only one that I know prohibits it for homeowners insurance.
Right. So my question is this. So I have the same pursuit as the chair and the sponsor, which is to lower rates. If we were to enact this law, is there anything that would prohibit Maryland auto insurers from, just because they're losing, in their eyes, a tool to assess the risk of a customer? Is there anything that would prohibit them from just increasing the rates to make up for that lack of risk assessment?
The whole point of insurance rating is to get it right, Delegate Pepe. You don't want to charge too much. You don't want to charge too little. So increasing rates, actually what would happen if this bill gets passed, and I've got a big company among my clients I'm testifying for, but mostly small companies would be disadvantaged. They would lose an important pricing tool. They would be less able to compete against the big guys. You'd have fewer, in my opinion, you'd have fewer bigger companies, and that is not more competition, that's less competition. And that's what I'm really here to tell you. You need more competition.
So just in a nutshell, because this is dragging on, so that would adversely affect potentially rates for Marylanders. Is that fair?
Well, it would diminish availability and therefore affect the cost of insurance for your constituents. They'd have fewer choices available to them.
Okay, thank you.
All right. Any additional questions? Delegate Watson?
Yes, this is for either Mr. Mosley or Mr. Popham. So you just told Delegate Pippy that there are no other states that allow, that prohibit credit scores being used on auto insurance?
No, I said I was not familiar intimately with the laws in those states. I believe that Mr. Mosley, who can confirm this, I believe Maryland's the only one that removed it for homeowners insurance. He can speak to that.
Mr. Mosley, do you know of any other states that have removed credit scores from autos, and if there was, or what the impact was when that happened?
So no, I'm not aware of any other states that allowed it and then removed it. There are 3 states that never allowed it from the beginning. And then those are the states I referred to earlier.
And do the other states allow it then, other than those 3?
Yes.
Okay. So if the bill is talking about 2 years, what would it, how would we, if we wanted to measure the impact of doing this over a 2-year period, what would we be looking for at the end of the 2 years to tell us as a committee whether or not this was good or bad for our for the public at large? Good, whether it was the best policy. How would we measure that after 2 years if in fact the committee were to pass it?
Mr. Mosley, you want to respond to that?
Well, so I think that's the question that a lot of entities, including INCOIL and NAIC, are wrestling with. Ultimately, if the goal is to, based on what I've been hearing, the goal is to make insurance more affordable or make it more available and less of a burden, then potentially there are some metrics that you could determine or identify that would help determine that. But the question really backs up a step, and you really have to determine specifically what it is you want the outcome of this passage to be to then be able to measure it. And really that's been the difficult question that both of those entities are still wrestling with, to try and define how to begin to think about and deal with this issue.
It sounds like to me that the bill sponsors would like the outcome of this bill to be that people are not penalized on their auto insurance for a poor credit rating that may not be within their ultimate control. And so if you wanted that to be the outcome, how would you measure this at the end of 2 years to know if it was successful?
Well, and again, maybe the nuance, maybe the question is really in determining kind of what you mean by penalized. So in a case where credit scores are disallowed, you're going to have two impacts. Obviously, those that have poorer credit scores are going to see their rates decrease. Those that have better credit scores are going to see their rates increase. And like I mentioned earlier, the general assumption made is that everyone that sees their rate decrease is going to be lower income minority populations. And based on what we've seen, that really isn't the case. And so ultimately, you really could have some people after this that aren't penalized because their rates go down, but others after this that are penalized because their rates are going to go up. And so how do you measure whether on net that's a good thing or a bad thing? Well, it depends on whose rates have gone up, whose rates have gone down. And part of what I think the concern is that when you pull credit out, it doesn't necessarily mean that the rates are going to go down for the groups of the segments of policyholders that we necessarily think they're going to go down for.
Right. Thank you.
If they aren't going to go down, then why do they necessarily have to go up?
Well, no, there will be some rates that go down. What I'm saying is that the immediate assumption is that everyone who's lower income and minority, those are the rates that are going to go down. And that's what I'm saying is the assumption that we generally jump to, but isn't necessarily the case. And so there will be rates that go down, there will be rates that go up, but the answer to whose rates go down and whose rates go up is much more nuanced than that.
So how much of a factor is credit? I mean, like I said, it was testified earlier, there are like 75 different factors, but by the mere talk of credit being, it would still seem to me that if there's 74 factors, there's still plenty there to work with. But apparently it sounds like credit has a disproportionate score relative to the other factors, because by in and of itself, if you go from 75 to 74, that would seem to be statistically insignificant in terms of what you have to work with. But if it's almost a guarantee that, you know, you pull this, something's going to increase, then it doesn't seem all factors are rated equal. It sounds like this one, while maybe one of 74, one of 75, it's disproportionately, you know, viewed or used in relation to the other 74. Is that generally correct?
So that answer is actually going to vary quite a bit by insurance company, even the kind of the number of factors. There are some companies generally tend to be smaller companies where that 75 really is going to be more like 20 or 25. And then there are going to be other more sophisticated companies where that 75 actually could be more like 100. But ultimately, the weight and how much impact credit has on a person's auto insurance rate is really going to vary amongst those different companies. And so ultimately, the question isn't necessarily just about pulling credit out. Yes, that's generally one of the rating factors that seems to be under the heaviest of attacks now. But it's a broader question to really understand not just credit score, but if you take away credit score and that doesn't necessarily solve the problem, then what's next? And ultimately, do we go down the path of trying to deal with this in a one-off scenario, or do we deal with the issue in a more comprehensive manner? And that's really the focus of risk-based pricing, is to deal with the broad spectrum of all the things that go into pricing a risk, not just the impact of one thing at a time.
Mr. Chairman, if I could just add to Mr. Mosley's comment that he just made about the smaller companies having fewer factors. That's most of who I'm testifying for today. These are the companies that would be most disadvantaged, and therefore they would be less competitive. You want them to be more competitive, not less competitive, and that this would disproportionately affect smaller insurers.
Delegate Pippi?
It was a lingering one, sorry.
Okay. Delegate Watson?
It was lingering too, but I just came up with another question. So on the smaller carriers, this is an interesting point, because what I think I understand you saying is the smaller carriers have fewer resources, so they don't have all of the latest modeling and technology and systems to compute their risk of loss. So they rely on credit scoring, maybe more so, and would have less ability to overcome the loss of credit scoring in their pricing. And in doing so, it could possibly make them less competitive. And it is true in my experience that the smaller carriers are more competitive in many cases against larger carriers. So I don't know. I mean, I think you're right. I think that's a very good point in terms of creating a not a level playing field between larger and smaller carriers. And that's all I wanted to say, if that's what you were saying.
Well, Delegate Watson, there's an example of that right in your county, very close to your backyard. You know who I'm talking about. I'm testifying on their behalf today as one of my clients. And I am here defending their ability to offer their products to your constituents, all of you, every member of this committee. We all benefit when you have more competition.
Delegate Ahrens.
Thank you, Mr. Chair. Mr. Mosley, I guess you brought up something there when you were speaking about that if we take this away, what's next? What would be the overall effect of it? And I'm getting the feeling that we could pick any one of the 74 criteria and pick it apart similarly, but the bottom line end result is our insurance rates aren't necessarily going to go down no matter who we are, because there'll be another criteria that will get abused more, if that's the right word, or be targeted more. We'd be able to sit back and put more weight on another piece. Am I following that, or am I off base?
Yeah, well, there would be other factors that potentially are adjusted to the extent that, again, the loss experience supports it. But I think the point I was making earlier is that because credit provides additional information over and above what factors other companies are using, it would not completely replace what you lose with the use of credit. To your point about this, 74 other factors, I think, again, conceptually, the issue is the ability of companies to support a healthy auto insurance market where they can match price to risk. And there are a number of examples throughout history in other states where when that imbalance starts to occur, it creates a marketplace that isn't necessarily efficient or optimal for customers. And so it's really about the idea of ensuring that we can match price to risk within, obviously, the laws and not using things that are unacceptable. But it isn't necessarily we would fight for every single factor, but it's really just more the concept of ensuring that essentially people are paying the price that's associated with the risk that they bring to the insurance.
Okay, and you're regulated. You have a board that goes through all these. We run every criteria through a group of people that we assume know what they're doing with as far as actuaries, right?
Absolutely. Actuaries are subject to standards of practice. They're subject to principles that we have to abide by. And obviously a review board, and even if it gets that far, a disciplinary board when we don't satisfy those standards.
I understand the concept of these bills. I have some troubles with some pieces of it, but hopefully we'll bring it to subcommittee and we can raise those. Thank you very much. Thanks, Chair.
Sure. Delegate Walker.
Thank you, Mr. Chair. This could be for whoever wants to answer the question. I almost just want to ask you all, do you think it's fair to use somebody's credit score to set their insurance rates. I mean, I'm just thinking, you know, when I was in college, I was a victim of a credit card company on campus. They got me, my credit score was messed up and I had a great job coming out. But then it's like, you know, why should my car insurance be affected because of a mistake I made in college compared to one of my counterparts who might have come from more wealthier backgrounds or knew financial literacy a little bit more? That's not fair for car insurance.
Let me answer your question this way, Delegate Walker. Maryland has a provision in its insurance rating laws that I probably and is in every other state. Rates cannot be excessive, inadequate, or unfairly discriminatory. That's why you got an insurance commissioner. They look at rates, they approve them, or actually we're in a competitive rating environment, but they have to meet those standards, and they can disapprove them after they're in use. So when you say fair, that makes me want to ask you, what is fair? What would be fair? It seems to me that fairness is, in the insurance business, a rate that allows you to predict reasonably well what your future losses are going to be. And the premium that you charge has to be enough to cover those future losses.
No, that's not fair. I understand that's the business model they look for, but because you could probably prove a point, you know, they make all their money back by charging more on the premium. That's why they're charging. We had the gentleman earlier from the JOTF who said, you know, there's cases where you got one person paying $3,000 because they've got fair credit, and the person with good credit's paying $1,000. And if you figure you use the numbers, you know, you pay your insurance, you know, whether it's quarterly or monthly, you get their money. They get their money. Chairman Davis had asked a question, and I want to follow up where he said, if we took credit out, and I believe Mr. Mosley said this, he said, the people that have poor credit, their rates would probably go down. Why do we assume that the people that have good credit, that their rates would have to go up? Shouldn't it be based off their driving record? Shouldn't it be based off of, you know, their accident history and things of that nature? It wouldn't have to go up automatically.
So the issue there's two issues. One is charging the right rate for each particular risk based on its characteristics. The other rate is the overall amount that insurance companies need to collect to make sure that they have money to pay claims. And so what we're talking about here is that second pot, not the first. And so if the elimination of insurance score doesn't cause the overall level of claim activity to go down, then if a group of customers' rates goes down, then the customers who were being charged less because they had good credit, their rates will have to go up to make sure that there's enough money left in the overall pot.
Well, if that's the case, somebody else would come in and say, you know what, you've got a good record, good driving record, you know, you can come and that's competition you guys have been talking about.
Well, correct. And the point is,
let me go with this.
Sorry,
We'll move on. This is my last question, Mr. Chair. So in California, what's their auto insurance industry look like now? So that's one of the states that does not have a credit check or whatever. Have you heard anything bad about it? Like, are people being charged more? They're being charged less? I mean, we know they've got a great fund that helps people that can't afford auto insurance, but what is California in terms of their auto insurance industry?
So in terms of California, the situation is quite a bit different. In California, there are only specific factors that can be used for the rating of insurance. And so essentially, as it sits right now, for those customers that in California that have better credit, all else being equal, they're probably paying more than they would under a system that would allow you.
I thought you said California doesn't charge credit. I thought we said California does not use credit as a determining factor.
They do not.
Yeah. So why'd you throw it in there? If that's why I picked California, because you said that they don't use credit score for your scoring. So why would you bring credit into the equation?
I apologize. I thought your question was asking what do their rates look like because they don't use credit, but
yeah, has there been something that's been detrimental to them because they came up, they have this system that does not use credit? Have you heard anything detrimental?
In terms of detrimental, the market is still functioning in California. Yes, there's some argument as to whether it's efficiently functioning, but it is functioning.
Okay. Well, if you got anything you can show me about whether that, with your last statement, if it's efficiently functioning, is okay. See that, get that to me. That's fair.
I will. There actually have been studies that have been done on California, and so I can certainly provide those to you.
Thank you. Thank you, Mr. Chair.
We're going to move, but you know what? I do need to clear up one thing because I think there was a misunderstanding, and I don't want that to be. I am not promising the bills moving forward. That's on the committee. All I stated was that I was supporting it. What the entire body does, you know, that we do together. It's not what Chairman Davis wants or anything like that. So I do want it to be clear. This is a collaborative process, and so that's that. Anyway, I want to thank all the witnesses. We have this enjoyable conversation once a year. I know everybody looks forward to it. But as always, we will give it great deliberation and you know, and as we need more information, if that's the case, we will certainly seek you out. And we do appreciate you all taking the time and sharing from the industry's perspective, your expertise in the area. We don't have that knowledge, but that's why we're all here. That's why, you know, you all are here to make sure we get that knowledge. So with that, I will declare House Bill 221 and House Bill 168 as being held. And now we've kept Delegate Palokovich-Carr waiting long enough. So Delegate Palokovich-Carr, House Bill 641, please.
Thank you. And thank you, Mr. Chairman, for your flexibility for me while the Ways and Means Committee was voting earlier this afternoon. So good evening. For the record, I'm Delegate Julie Palakovich-Carr, here to present House Bill 641. This bill would strengthen consumer protections in homeowners insurance for weather-related claims. Maryland currently has a 3-strike rule for weather-related claims. An insurance company can cancel or not renew a homeowner's insurance policy if the homeowner files 3 or more weather-related claims within 3 years. State law, however, is silent about whether these have to be paid claims. This bill would clarify that a weather-related claim that results in no payout to the customer or that is for less than the insured's deductible does not count towards the cancellation or non-renewal of the policy under the 3-strike rule. This bill would put Maryland in the same posture as every other state that has comparable protections to Maryland regarding weather-related claims. These states all specify that only paid weather-related claims can count towards the non-renewal or cancellation of a homeowner's insurance policy. And this legislation would help prevent homeowners from losing their insurance. It's a situation that a constituent of mine experienced. After 46 years of continuous homeowners insurance coverage, during which time he never made a claim, he got unlucky in terms of weather damage. Within a 2-year period, his community was struck by a hailstorm and then a series of windstorms. He made 3 claims to his homeowner's policy over the course of 2 years because of weather damage. His insurer paid out on claims number 2 and 3, but not the first. Months later, the insurance company notified the homeowner that his policy was being canceled because he made 3 weather-related claims within 3 years. Mind you, these claims were no fault of the homeowner. They were caused by weather, and there was nothing that he could have done to prevent them. And in one case, the claim was resolved without payout by the insurer, yet his insurance was canceled nonetheless. This bill would treat weather-related claims the same as other instances when the insurer does not pay out. For instance, insurers in Maryland are not allowed to increase premiums, cancel or non-renew a policy, or refuse to issue a policy if a homeowner inquires about a claim and the inquiry does not result in payment of a claim. This legislation should not materially impact the bottom line of insurance companies. As noted in the favorable testimony of the Consumer Protection Division in the Office of the Attorney General, quote, while there are expenses involved in a loss that may not result in payment, those expenses usually are small and should be considered a cost of doing business, end quote. Finally, I'll note that we have written testimony in support of the bill from the Maryland Consumer Rights Coalition. Thank you for your time and consideration.
Sorry, I forgot to unmute myself that time. Any questions for our colleague? If not, thank you very much. John McLean.
Thank you, Mr. Chairman. Good evening, and thank you all to all the members of the committee. My name is John McLean. I'm an Assistant Attorney General. I'm with the People's Insurance Council Division. It's a pleasure to be here this evening. For many of the reasons that the delegate sponsoring the legislation just indicated, People's Insurance Council is supporting this bill as well. We think this is a good common sense measure to protect consumers, Maryland homeowners who may be faced with this sort of situation. I was there as well last year when Mr. Silverman testified as to his situation that happened and the cancellation or non-renewal of his insurance. So I think this would clarify for both consumers and companies how they would treat weather-related claims and whether there is a payout to the consumer. And I think it's important that the proposed legislation is whether the amount paid by the insurance company is either less than the deductible or that there is no net payout to the homeowner. For those reasons, People's Insurance Council urges a favorable report on this bill. Thank you.
All right. Nancy Egan.
Hi, everyone. I guess we're the wrap-up bill for the day, so thank you. My name is Nancy Egan, and it's great to see everyone again. I haven't testified in front of the committee this year, so I represent the American Property Casualty Insurance Association, and we write 60% of the property casualty insurance market. I appreciate the opportunity to provide comments in opposition to House Bill 641. Maryland is unusual. There are states in our area, like Delaware, we require 3 weather-related claims in order to cancel a policy. DC says that you can cancel after 2. West Virginia is 1. Virginia doesn't have that, and neither does Pennsylvania. So just to look at our surrounding states. Just a reminder that under the current law, if a person should call into their insurance company or to their agent and make a question about whether or not a type of loss is covered, or they just want to talk to their agent about that and don't want to file a claim, that cannot be used against the insurer for that loss. And an inquiry can't be used in underwriting the claim either. I reached out to Robert Barron at the MIA, and I asked him, and he said that that this type of lower than the deductible are used by some people in the marketplace. So not all insurers are doing this. So let's look at something else that's in that unfair discrimination section of 27501. A carrier can also say, yes, I'm going to look at your 3 losses, but if the losses have been very severe, then yes, I will cancel. But if they're less than that, maybe I won't cancel. Or they may look at how long you've been with that insurance company. Or let's say you did have a tree fall on your roof, and then you did remove the trees, so you mitigated your loss. These are all different options that a carrier can use when looking at those 3 claims. I know that we said last year when the MIA provided written testimony that they had received 114 consumer complaints about homeowners insurance and cancellation. Of them, only 5 were related to being canceled because of having 3 or more claims and being canceled. The Maryland insurance market is very viable. But I do need to remind you that back in 2011, that there was a big hearing by the insurance department because about the availability of homeowners in the coastal areas. There were some homeowners that were looking at to not write in certain areas of the state. So I think that you need to understand that losses are something important to us, and you're removing one of the tools. So I know that last year the delegate mentioned about not being aware of this, but I do want to point to the fact that this issue had been studied by the insurance department because carriers were concerned about writing along coastal areas. There are viable markets in case you are canceled. There's the surplus lines market, which currently is available in a lot of those coastal areas as well. So you need to balance that with removing this ability to cancel for weather-related claims. And with that, I'm happy to answer any questions.
Right. Robert N.
Thanks very much, Mr. Chairman. I think Ms. Egan covered it, and I'd be happy to answer any questions.
Okay, then we'll close out with Andrew Kirkner.
Thank you, Mr. Chairman. Andrew Kirkner again on behalf of the National Association of Mutual Insurance Companies. I won't beat Bob's testimony record there, but I will keep it very brief. Maryland already has a very restrictive law regarding the use of weather-related claims on homeowners policies. It is an outlier in that respect. It's certainly not alone, but it is an outlier. Requiring more than 3 claims or 3 claims in 36-month period is a pretty high threshold for insurers anyway. And really, Mr. Chairman, the purpose of my testimony is just to highlight the role of agents in this process. Ms. Egan briefly touched on this. I would just like to say, as a matter of anecdote, this is what the role of agents are, is to call an agent, to figure out what the impact of some of these claims might be, to call companies, figure out what the impact of these claims might be. That is not factored in, as Ms. Egan testified. And so we believe there are adequate protections in existing state law, but we appreciate the opportunity to be back before the committee. Thank you.
Questions? If not, that concludes the bill hearing and the witness list for House Bill 641. Thank you, Delegate Palokovich Carr. Again, thank you to everyone who stuck around as we had floor work to do. We appreciate you waiting on us and all that you contributed. Members, thank you very much. Everyone have a good evening.
Thank you.